We've been on this journey now for about 7 years. And so I was asked to share with you a little bit about what we've been doing over the last 7 years, how we've sustained it, what have we done since the 4-hour initial basic communication course. So I know this is a busy slide, but it just is a high-level reflection of what we've been doing. So it started before the Pearls course, the 4-hour course that my colleagues here have described beautifully. We were charged by our CEO at the time in 2003, Dr. Denny Cortez, to start looking at what we can do as a healthcare organization to differentiate ourselves in the area of service. So service became the priority for Mayo Clinic starting in 2003. What we did is he charged Bill Maples and a team to just go and look at our history, look at the Mayo Clinic, the Mayo Brothers, and our Mayo model of care, and pull from that, extract from that, what are the behaviors that we as an organization need to embody and embrace and continue to enhance in order to maintain our brand and to further advance service delivery in our system for our patients. So with that, we started down this road. We identified mutual respect, communication, integrity, teamwork, personal responsibility, and innovation as those behaviors that we need to really embody. So at the same time, this same group led by Dr. Bill Maples decided we really needed to understand from our patients. We needed to survey our patients and find out really from them what do they want in terms of service delivery. We could guess, we think we know, but what we did is we hired an outside agency to survey, do quantitative research of all of our patients, a subset of our patients, outpatient, inpatient, and ED. So with that data, and then doing our own some national studies, working with experts from the American Academy of Communication and Healthcare, we created the 4-hour communication course, basic communication. We learned that what patients really want, above all, above technology, is caring, compassionate physicians and providers that listen and value them. So that's how we started with our 4-hour course. The elements are listening, relationship building, agenda setting, information gathering. From there, around 2006, our Board of Governors said, you know, we've got this burning regulation that we need to address health disparities and diversity. Came back to our group and said, what can you do for us? So the second, as a longitudinal effort, we came back 2 years later, trained all of our physicians and residents and staff in a 4-hour course modeled exactly the same way that our initial course, didactic, lots of skills work, lots of practice, and lots of large group discussion. We worked on diversity. As we were studying diversity and closing that gap in health disparity, we're working again with the American Academy on Communication and Healthcare and other organizations and some experts from California, and asking them, what do we need to work on? And what we found out is the same things. It's pearls, it's empathy, partnership, listening. So we built our diversity course using the basic communication course as the foundation, reinforcing those skills again. In 2008 is when and they hired me around 2005 because service became the priority. So this kind of the way we went down this path. In 2008, 2009, there was a shift in priority as an organization. We needed to work on safety. Now the organization said, okay, we've worked on service. We want to be the safest healthcare organization in the world. I thought for sure I was going to be out of a job until we started to study that with national experts, and what they told us, to be safe, you have to work on teamwork. And in order to be good in teams, you've got to work on communication. You've got to work on relationship building. So yay me, I got to jump in and work. Again, that course, we call it Teamwork is Real. We reinforced again the learnings from Pearls, our basic model, because in order to be safe, we have to have great teams. In order to be great in teams, we've got to communicate well. From there, Navy is challenged with providers, wanting extra help. At the same time, a lot of this work is happening in parallel processes. We had physicians. We started to dig down and look at physician data. So we were getting our patient satisfaction at the physician level. And around that time, physicians were calling me and begging me to come to their office. And this one particular orthopedic surgeon said, please come in. He'd been practicing for 25 years at Mayo Clinic, well-established, well-respected surgeon. And he said, Terri, sit down, close the door. I can't believe what my data looks like. I've been doing this for 25 years, and I thought all this time my patients really loved me. I thought I was doing a great job for them. It was really hard for me to even hear it. He goes, please help me. He pulled out our didactic, our slides. He had a handout of our slides. He said, I thought I was doing the pearls all this time. Will you please come and follow me in my practice and just tell me what you see? Because I thought I was doing this. With that, I went running to Bill Maple's office and said, we've got to do something for these physicians. We've given them the data, now we've got to build a tool set. And we thought that, so we worked again with colleagues that are experts in coaching and build a program and have some of our facilitators trained as coaches to go and do one-on-one coaching with our physicians, watching them, talking to them, again, re-emphasizing the pearls. Since then, we've recommitted to a safety. We're right now in the throes of a humongous, intense safety project at Mayo Clinic. And what I want to get to through this diagram is that in every one of these programs, we had the opportunity to reinforce the basic model. So where do you go from here? You start with that model. Almost every initiative that we've come up against, every new improvement, we go back to we need to communicate well, we need to listen, we need to do relationship building. So that's the nice, smooth model. The reality of it is, and it all goes back to the service values. I was giving this talk, or a similar talk, at an international conference some years ago, and someone said to me, she raised her hand in a group about this size, and she said, well, of course, you're a Mayo Clinic, you all live in the land of Oz. And Dr. Maples and I about fell over, and the other surgeons that were in the group that are part of this team, and I'm here to tell you we don't. The reality of it is, this is really what our journey looks like. The roads are twisty, turny, you name it. And I added a couple of road signs of my own because that's the reality of what our journey looks like. I just want to list for you, I know I'm short on time, but I want to list for you from 2002 until 2003 until today, here are some of the challenges that we have faced. We went through 3 CEOs. We came up on our electronic medical record. We had our executive administrator who was sitting at the executive board spearheading this. I wish he was here, Carl Ryder, who really taught us how to drive this through the organization. He retired. We thought for sure we were dead in the water when he left us. We moved down JTB, literally in ambulances, moving our patients. If you can imagine, we're going to talk to people and say, we need to do this Pearls course, and our people are looking at us saying, we are moving into a new hospital. You can't be serious. We had major financial issues, such that we had a CEO change who came in, Dr. Bill Rupp, who came in and said, we're going to cut waste. We thought for sure this was going to be cut. Not that we didn't see it was waste, but we were just shaking in our shoes. Of course he didn't cut our program. We have had major practice changes. Our physicians are pushed for productivity. We lost some of as a team, of a facilitator team, we started with 8 of us. We lost 1 to cancer. We lost others to the pressures of the practice. But we had to rebuild and we keep going. We have programs such as staffing to workload, safety programs, and our among other things. These are just the few that were at the top of my mind. So our organization is not much different from yours. And actually, I had the privilege of working with UNF staff, Dr. Dean Challey, last week. And that organization is going through the same stuff. It was really interesting. We had major gains early in the program, and we've been able to sustain over time through much, much trepidation. Our outpatient data, same thing. This is % excellent. We've been able to maintain gains. Bill showed you this earlier. This is our staff satisfaction. It goes up. 2011 data is trending similar to 2009 for these same metrics. So what does it take to sustain? I'm just going to go through quickly. Alignment with the strategic plan. This had to come from the top. Our executive leadership made a longitudinal commitment, and they built in accountability. The behaviors that we have listed and that we came out with in 2003 are all part of our appraisal. We get graded on that. Physician administrative partnership, I can't say enough about that. It takes both sides of the house working together, being champions at the executive board table, talking this up, making sure that it stays in the forefront. Dedicated team. We have a team that's been together since 2005. Dr. Wes Paul's at the table up here. Him and I have been working on this since 2005. I can't say enough about how important this is, and I'm a dedicated resource. I'm a co-director for our communication healthcare program, as well as I lead the service initiatives for the organization. But I dedicate my time to this. Our team represents the entire practice. We have surgeons, family medicine, internal medicine, hospital, specialists. And one of the things I can tell you about our team is we are committed to enhancing staff behaviors. We refuse to just check off the box. When our executive board says, hey, can't you come up with a PowerPoint slide to just, get this done? We look at them and say, are you kidding? No, we can't do that. Of course not. We are aimed at enhancing behaviors. What we do, actually, we don't say that. We say, what is the goal here? What do you really want to have happen here? If it's enhancing behaviors, then we've got to do the work, which means bringing people to the table, bringing them out of their environment and working with them. Peer-to-peer teaching and learning model, there's a lot to be said for that. We do not use our program directors or educators, our trained educators. We love them. They're fabulous. But we take people from the practice. All of our team members are practicing physicians and allied health. And the beauty in that is that when a group comes to us, and they come reluctant because, let's face it, you're all hardworking physicians. You don't want to come and be told how you can communicate better. You've been doing this for 20 years. But when they see a vascular surgeon stand in front of them, a seasoned oncologist, a family medicine physician, who they know just saw 25 patients before they came to the class, they know that our vascular surgeon had a full operating room that morning, it stops them in their tracks. They all of a sudden take a deep breath, sit down, and think to themselves, if they can be here, I can be here, and at least respect them enough to listen, and then we have them. Then we get them in our small groups, and they start doing the work. Teamwork, we've done this. As we've gone through, if we progress down the road here, we have really done some tremendous work in trying to break down the silos that exist in healthcare. And I think there's a tremendous amount of work that we all need to do in this area, and that's bringing physicians and allied health together to learn and train and work through some of this together. We've done that through our programs. And finally, it takes vision, innovation, patience, and resilience. This is hard work. Someone said it earlier that we didn't do this and we don't do this because it's easy. We just do it because it's the right thing to do. But it is tremendously hard. But we just keep going. And I encourage all of you to do the same. So thank you.